Welcome. Thank you for joining. This is the February 2nd webinar of the Connecticut SustiNet Patient-Centered Medical Home Committee. I'm Ellen Andrews. I co-chair the committee with Dr. Tori Westbrook. The committee has had a lot of questions about what it takes to be registered as a patient-centered medical home. And today we're going to hear from Mina Harkins, Assistant Vice President for Physician Recognition Programs at the National Committee for Quality Assurance, NCQA, about that process. Some housekeeping for people on the line. If you are listening on the phone, remember you have to input the audio PIN that should be visible on your screen if you want to be able to talk and ask questions. If you're listening on a headset directly through your computer, you don't need the audio PIN. We have 32 people registered in addition to the 4 organizers. We have 22 online right now. As of a few hours ago, 32 were registered, so I will be keeping everyone on mute until mine is finished, and then we'll have some time for questions. To ask a question, you can raise your hand. There should be a little button somewhere to do that. But to save time and to be sure that you don't forget your questions, you can also type them into the text box under the question pane, and those will, at any time, you can do that at any time during the seminar and the webinar, and then you can, then I can ask your questions. Mina's slides will be posted on the SustiNet website soon, and a video of this webinar will be available online just as soon as I figure out how to do that. Mina is, as I said, the Assistant Vice President for Physician Recognition Programs for NCQA in Washington. In this position, she is responsible for the operation of 4 physician recognition programs. These programs are focused on chronic conditions such as diabetes and ischemic vascular disease, active management of low back pain, and the systems and processes utilized in physician practices. Before joining NCQA, she served as Accreditation Division Manager with COLA, a CMS-deemed physician office laboratory accrediting organization. She's also been Director of Anatomic Pathology Operations at Quest Diagnostics. Prior to this, she held a number of positions at a multi-specialty group practice, including Manager of Laboratory Services and Supervisor of a Surgery, Urology, and Plastic Surgery Practice and Surgery Suite. She began her career with a staff model HMO in Washington, D.C., where she managed the Department of Laboratory Medicine. Mina earned her BA in Medical Technology at the University of Pittsburgh and her MBA at Hopkins School of Professional Studies in Business and Education. We are very lucky to have Mina. There's been a lot of interest in medical homes around the country lately, so we are very fortunate to have her time. Thank you, Mina.
Well, thank you. If you want to go over to the next slide, and I'll speak a moment about our objectives for today. We only have an hour, and this is a very comprehensive program. I will try to make the best use of that time to provide you with an understanding of the NCQA recognition program for Physician Practice Connections Patient-Centered Medical Home. That's the full formal name of the program. I'll then take a little bit of time to introduce you to our web-based survey system, which is the system that is utilized to submit information to NCQA to evaluate a practice against the standards and to hopefully have the practice achieve recognition. I'll go through a little bit about the standards and documentation requirements, but mostly there I'm going to need to point you to various resources to go into the detail of each of the standards and show you some resources that are available for you to participate more fully in a standards workshop, for instance. And then I'll highlight the application and submission process so that you might have an idea of what a practice would go through in order to participate and get recognized in our program. On the next slide, I'm just highlighting the various recognition programs that are available through NCQA's Physician Recognition Program. Could you move the slide, Ellen, to the
Sure.
next
And
one?
can I urge the four of us who are not muted to make sure that we keep the noise down? I'm hearing that people are getting some feedback from speakers or from phones. There. And it's not moving forward. Why? Oh, there we go.
All right. Currently in NCQA's physician recognition programs, we have over 15,000 physicians that have been recognized or who are currently recognized in the recognition program. And our clinical programs include the diabetes recognition program, the heart stroke program, and the back pain recognition program. And then we have two other programs that are focused on medical practice processes and structural measures. The original program was called Physician Practice Connections, and built on that is the program we're speaking about today, the Patient-Centered Medical Home Recognition Program. And below that you can see some idea of the number of physicians and practices that are recognized in those various programs. NCQA has been involved in physician recognition programs for over 10 years. Of course, its original focus was on health plan accreditation and HEDIS measures. And so for many physician practices, introduction to NCQA is a new organization with which health plans have been familiar, but maybe not physician practices so much. On the next slide, you can get a picture across the country. There's a move ahead, okay. On the next slide here, we've broken out various numbers of physicians that are recognized around the country. I will note that Connecticut, although small, is highlighted there in the 100 to 500 recognition range. There's slightly over 100 physicians recognized in Connecticut, primarily in our diabetes and our heart stroke program. On the next slide, I've outlined for you the recognition specifically in the patient-centered medical home. And unfortunately, we have yet to recognize a practice in Connecticut, so I'll encourage someone to be the first. But this shows you a bit of the distribution. Those states that have a significant number of practices, now this is practices rather than physicians, but those are ones that have had various initiatives or projects. You can see significantly Pennsylvania, New York, New Jersey, New Hampshire, Louisiana have had quite a bit of focus in using this program to recognize practices. And the various colors are showing you our different levels, and I'll speak to that in a moment. The practices, as you can see in Louisiana, there are significantly more level 1 practices. This was an initiative that was focused on rebuilding primary care in the New Orleans area after Katrina, and the practices are working very hard to rebuild and came into the program at level 1, but a number of them have then moved on to a level 2 or 3 practice. And that's in contrast to some of the other states where there are certainly practices that are larger. That's all right. On the next slide, let's look at the size of the practices. It's been some concern to practices that smaller practices cannot participate as easily in this program, but you can certainly see on this slide that there are a significant number of practices that are 1 to 2 physicians or 3 to 7 physicians that have achieved recognition, and certainly many of them at level 3. Across the country, that's about 58% have reached the level 3 recognition. And on the next slide, we'll begin talking about the goals for the original physician practice connections was to recognize that a systematic approach to delivering preventive and chronic care, much of it based on the Wagner chronic care model, was a way to provide a better coordination for patient care, and really looked at the Institute of Medicine's recommendation to shift from blaming individual clinicians from practicing in silos to improving the systematic care and coordination of care for patients. So these measures were created to be ones that were actionable at the physician practice level. This allows a physician to really be able to bring this type of coordination into their practice and contribute to that coordination of care for the, especially the patient with the chronic condition or complicated medical conditions. These measures have all been validated by relating them to clinical performance. Field trials have been done and patient surveys to really focus on their direct impact on patient care and patient experience. On the next slide, we just note the adaptation that was made in the Physician Practice Connections program to establish a new recognition for the patient-centered medical home. NCQA worked with the American College of Physicians, the American Academy of Family Physicians, the American Academy of Pediatrics, and the American Osteopathic Association to align the program with the endorsed standards of the patient-centered medical home. This group also worked on determining which of the various elements, requirements in the program were considered core elements to the concept and the model of the patient-centered medical home, and those were designated as must-pass requirements. On the next slide, I've included for you the endorsed principles of the patient-centered medical home, and those include the concept of the personal physician. So this program is, of course, focused on the primary care clinician and the primary care practice, whether it be a multi-specialty practice or not. We're really focused here on the physician that provides for that continuous, comprehensive, and coordinated care for the patient. Whether or not they're personally providing the various services and capabilities is not really the point. It's just that they are directing the medical practice and leading the team who collectively take responsibility for the care of the patient. The other important concept to the patient-centered medical home is whole person orientation. While we realize that patients are obtaining care from other qualified professionals, it really needs to have some practice or some method of coordinating the care and a home for all of that information on the patient that they are required, or they require in their medical care, but may not be something that is provided directly at the primary care practice. And so we're really looking further beyond the practice and asking that primary care clinician to coordinate the patient's care across all the elements of the healthcare system. On the next slide, we'll discuss the recognition is based on the individual practice. Now, we understand that there are many multi-site practices, but each site does have to qualify by completing a survey. NCQA defines a practice as a physician or physicians practicing together at a single geographic location, and so our recognition and the level of recognition is at the practice site level. On the next slide, I'll give you the introduction to the standards that are the foundation of the program. Each of the standards you see here, there are 9 standards numbered through 1 through 9, and indicate a different area of process or care for the patient. within each of these, there are what we call elements, and those are indicated by letters. And the various elements that make up the requirements in that particular area, that particular standard, each have a score associated with them. The bolded elements that you see here are those that are designated as must-pass elements, and those figure into the scoring, which I'll show you in a moment. Each of these elements requires that the practice meet various factors that are explained in a detailed set of guidelines and requirements. Those guidelines and requirements are available free from NCQA, either by calling our customer support line or registering on our website, and they will provide the detail for each of these elements. You don't necessarily have to achieve an element completely, so there are partial scoring that is available for each of these elements. The entire program does add up to 100 points, but it's not something where no one gets a perfect score, let me put it that way. You are building the points to achieve a level of recognition, and through that building of various capabilities and elements, you achieve a level of recognition. On the next slide, let's look at what that scoring looks like to achieve various levels of recognition. As I noted, there are 10 must-pass elements, and passing a must-pass element is considered at the 50% performance level. So, for instance, if an element has 4 points assigned to it, you must achieve at least 2 points in that particular element to pass the element. And because there are different levels at which you can pass various elements, there is also a point score as well as the number of must-pass elements that go into determining the level of recognition that's achieved. You can achieve level 1 recognition with 25 points and 5 of the 10 must-pass elements, and that would give you a level 1 recognition. If you are achieving 50 or 60 points but don't have all of the 10 must-pass elements, you will note that you would still receive a level 1 recognition until you can achieve the 50% performance level on all 10 must-pass elements. And we do have a process through which you can become recognized and then work on building additional capability to allow you to move up to another level. Let's go to the next slide and focus a little bit on what these must-pass elements are. And they are distributed throughout the standards. There are at least one must-pass element in all of the standards except for Standard 5 and Standard 9. Standard 5 is electronic prescribing, which at the time the medical organizations that were assisting in determining the core elements for must-pass felt that that was perhaps setting the bar a little bit too high to start with. As you probably know, that's considered an important element of IT use within the physician practice and the current discussions going on about meaningful use. And the other standard in which doesn't include a must-pass element is advanced electronic communication, and that's Standard 9. And that's because that allowed some practices that have made excellent use of some of these new types of systems and communication modes, such as we're using today for this presentation, and where they're able to use those for their patient care, there's some additional points available. But most of these are focused on the basic elements of coordinating that model of patient-centered care. So looking at access and communication, using charting tools to organize clinical information, to adopt evidence-based guidelines for conditions that are frequently cared for and seen in the practice, and then looking at patient self-management and various systems for tracking, testing, and referrals within the practice. And then the area, of course, that's very important to NCQA is looking at performance measurement and performance improvement and how that can be utilized within the practice to improve patient care. On the next slide, I'd like to address the use of health information technology. It is sometimes focused on, in looking at NCQA's program, that you must have an electronic medical record or that it's all about information systems. But it's really not. Each of the elements has a designation of what level of health information technology is needed to perform the functions. And when it's labeled basic, it is an element that can be passed with a paper-based system or mostly an administrative electronic system such as a practice management system, billing system, appointment system. If it's designated as an requiring an intermediate level of HIT, it would be one that looks for the practice to have a fairly extensive registry or certainly an electronic medical record, electronic health record that can handle clinical functions. And then the few elements that require advanced health information technology are ones where the practice would need to be able to connect with systems external to the practice. On the next slide, we've laid out for you just a basic chart to show you the elements that can be passed with the basic, intermediate, and advanced levels of health information technology. And you can see that you can achieve a passing score on all the must-pass elements with basic information technology. Now, in many cases, you would not be able to achieve the full score on those, but you would be able to achieve the 50% score. And so it's to encourage those practices that are going through the process of bringing in more systematic approaches to consider that they can become recognized as patient-centered medical homes without having the more extensive clinical systems available. So let's go on to the next slide, which you can kind of skip over quickly, and talk about the application and survey process. On the next slide, I've just outlined for you the steps for the physician practice, and I'm going to show you what a few of these steps look like so you have a bit of a better picture. You're basically covering step 1 today to look at some of the program information, and hopefully I can show you where to find more extensive information for various elements of the program. Then we highly recommend that you participate in a standards workshop. The information on our workshops is posted on our website, and that link is shown on the slide here. And that would allow you to get some of the detail of each of the standards and the kind of documentation that you would need to develop in order for NCQA to assess whether you're meeting that standard. We do have an online survey tool, which is your submission is required to use our online system. That is something that you do need to purchase. The workshop and the PDF copy of the standards that you can order are free. To obtain a survey tool, though, you do need to purchase that. It's an $80 software license. You do need one for each practice site. Then we recommend that you participate in a live demonstration of that survey tool on a monthly basis. We have a live webinar such as this where you would participate, and one of our managers actually walks you through the flow of the program and the various utilities and steps that you would need to be familiar with to complete your survey for the patient-centered medical home. This is a survey tool that you utilize within your practice. We highly recommend that you use it first to self-assess your current performance. That would allow you to see where there might be changes that you need to make within your practice in order to achieve recognition as a patient-centered medical home. And you can use that survey tool as long as you choose to before you would ask NCQA to evaluate your completed survey tool. And once you are ready to do that, you do complete some documents for us, an application, an agreement, a BAA, and pay an application fee and distribute those results to submit those surveys and documents to NCQA when you're ready. NCQA has several steps that they must go through to evaluate your information and documentation. This is generally all done off-site or done here at NCQA, so it's an electronic relationship, I guess you would call it. On the next slide, I've included some detail here about using the online survey tools, and I'm going to show you what many of the screens look like just to give you some familiarity with that. As I said, you purchase the license. NCQA will give you your ID and password. It goes to the person whose email is provided with that purchase, so you want to make sure that's the person who will be managing that process within your practice. As we said, highly recommend that you attend the free training programs. And then you're going to be asked to select some important conditions within your practice that you'll use for many of the examples of documentation that you're going to provide within the survey. You're going to attach documentation for each of the elements which you wish to be achieve a score for. You can then at any time review your results. It has an automatic scoring system within it. At the last couple of steps require you to send and file an application with NCQA that you intend to submit a survey to us, and we will confirm then that we link your particular license to our server. That's going to allow you to upload your documents so that we'll be able to see them and to submit your survey tool. So on the next slide, I'll introduce you to our survey process, our survey system. And this is NCQA's main homepage. And you can see on the right-hand side there, you can go right there once you have your login and password to go into our system. You can click right there on our web page to log in. And the box next to it that says recognition, that's where you would go to get to our specific web pages for our recognition programs that give you our calendar for training programs. There are many documents on our page that you can download that give you some information that you might want to be sharing with other organizations or people that you work with. It gives you some detail about the program itself. There's a specific write-up about this recognition process that you can refer back to. Certainly all these details are difficult to capture all in one short hour. And then we also have FAQs and other companion guides and resources that are pointed to on those pages. On the next slide, just to introduce you to the web-based survey tool, this is NCQA's interactive survey system called the ISS. It is the same system that NCQA uses for health plan accreditation and disease management certification, all of the various types of surveys that NCQA does. You use this survey system to enter responses about your various types of capabilities and systems within the practice. It has an area where you can attach documents and that you can provide some explanation of how a particular type of requirement is met within your practice. And then, as I said, it can give you a running score as you work on various elements to show you for yourself how you're meeting the various requirements. On the next slide is the where you would log in, and this is the welcome page that takes you to NCQA's system. And there on the left-hand side you see that this is a PPC-PCMH survey, and this particular one, of course, is the one assigned to me. And you would click on that link on the left-hand side under where it says PPC-PCMH, and that takes you to the next page, which is your entry to the survey tool. So if we can go to the next page.
It takes a little while to load.
Oh, okay. Sorry, I'll try to give you a little more heads up. This is where you enter the survey tool. You can see there's a extensive menu bar across the top, all the various features of this software program. Similar to any software program, each of these either has a pull-down menu or takes you to another screen that has various capabilities. The bottom menu bar does take you to some various documents. You see the standards and guidelines there, so if you haven't already obtained a set of them, they do come with your license to the survey program. But this is where, by clicking on this gray bar that says Physician Practice Connections, Patient-Centered Medical Home, takes you directly into the survey. And so if we go to the next slide, you'll see that that allows you to jump to any portion within the survey. It is exactly built on the 9 standards that I showed you on that table before, and each of the elements is indexed there so that you can jump to whichever element you wish to work on at a particular time, or you can start at the beginning and go from element to element. On the next slide, I'm giving you an example of what the very first element looks like. And the standards and guidelines document that you might purchase has exactly the same information, but of course all in text. But utilizing it within the survey system, each of those buttons, and we call them radio buttons, does start to contribute to your score. So as you answer yes or no, have you established in writing standards for the following process? Do you have a standard for scheduling each patient with a personal physician for continuity of care? If you answer yes, that would start to build on your score for that particular element. So on the next slide, we're just taking you further down on that same page, and as you answer each of the questions, you'll find at the end of each of the elements there's a box indicating the scoring for that particular element. This one shows you to obtain 100%, you would need to have a written process for at least 9 to 12 of the 12 items listed there, and shows you the various breakdown and score. If you have 4 to 6 items, you will pass this must-pass element at the 50% level. Then it goes into a little bit of detail right on the screen for the data source. But when you get to the reference information shown by the green box, that it takes you to some more detailed explanation and examples. And if you compare that to the written copy, in the written copy of the standards, that text is just right there on that page, but it's a bit too much to have right on the same screen. But everything is available on the survey screens that is available in the standards document. So on the next slide, I'm highlighting what those blue boxes are at the bottom of the screen. Those are available to provide some explanatory text. It is really helpful because we're not there in your practice talking with you for you to explain in how the documentation that you're providing supports your answers that you've given above. And the document box takes you to a link to allow you to upload documents or link documents. It's very similar to attaching a document to an email. So on the next slide, I'm showing you another element of the menu in the survey where you can click on the results box and go on to the next slide. And this will take you to a set of screens that allows you to drill down through the various levels of score. On this first page, it shows you just your overall score. But if you would click on where the green box is showing you the must-pass results, on the next slide, I show you a detail that is brought out for the specific must-pass elements, and can show you on one screen very quickly if you passed each of the must-pass elements, what your score was for it, and then in the green box on the left shows you the maximum status that you could achieve with the score that you've shown. Now, of course, that is the self-assessment for your practice, and of course the purpose of submitting that information to NCQA is for us to then evaluate and confirm whether we agree that what you've described in the documentation that you've provided to us does in fact meet the requirements for that particular element and standard. On the next slide, I'm just giving you a little bit of information about the kind of documentation that you would need within your practice. It does take a fair amount of time if you really haven't already incorporated some of the patient-centered medical home principles within your practice. We're often asked, how long does it take? I can tell you that when CMS was proposing the Medicare medical home demonstration project, they felt practices needed about 6 to 9 months in order to make the transformations within the practice that would be needed to be recognized and to perform as a patient-centered medical home. And that's really highly individual to your practice, but that's just some experience in discussions that we've had. As far as documentation, we really want to encourage you to establish the various processes and procedures at least 3 months before your submission, so that you've had time for those to become established and to really have an impact on your patient care. But then, of course, we have various reports and performance measures that we ask you for, and we ask that those not be any older than 12 months because, of course, we want to know how your practice is performing at the time of submission. And then there are a few measures that have numerators and denominators, and for the most part, we look at a segment of your patient care over the last 3 months when it is an element requiring the percent of a patient population that you do one of these elements. And so those are generally over the last 3 months or over a 3-month period when you collect the data. The next slide just highlights for you the steps that NCQA will go to once we receive your survey tool. We evaluate all of your responses, documentation, and explanation. If there's something that doesn't appear to be there or that it's not explained clear enough for the reviewer, we may need to contact you to get some clarification. We do an on-site audit of 5% of the practices, but we also do smaller paper audits of particular areas where we might have a question about whether something is fully implemented. Because we use a large number of reviewers, although they are experienced NCQA reviewers, in order to provide continuity, we do an executive review, and that's one of my senior staff here that would assure that the reviewer follows our expected interpretation of those requirements. And then finally, there's a peer review by a physician on our review oversight committee. And at that point, you would receive a final decision of your scoring and your level, which we do report to you immediately by email, and that same time you are posted to NCQA's website, where we have a recognition directory which shows all of our recognized physicians and recognized practices. We do not report practices that do not pass. Generally, you wouldn't submit to NCQA for evaluation if you don't think you're ready to pass the recognition level. But we do have some projects where they've asked the practices to submit a current assessment, and so just to point out that we do not publicly report anyone who has not passed. You do receive a certificate showing your recognition period. Recognition is for 3 years. Because the program isn't 3 years old yet, we do get a lot of questions about what happens after 3 years. NCQA is conducting an evaluation of the program. There will be a public comment period, and there is detail on our website if you have input that you would like to contribute to NCQA's effort to make sure that this survey continues to be relevant to the clinical process and issues as it goes forward into the future. But we will address whether a practice has to go through a full survey after 3 years, or whether there will be just a review of at a lesser level. All of that is under discussion at the present time. I would note, though, that if you achieve a level 1 or 2, you can do an add-on survey within the 3-year period and increase your level of recognition. On the next slide, I'm just covering for you a number of the training opportunities and resources that are available. We do also have a recorded version of the standards workshop should you want to take that program and present it at a staff meeting or a network of physicians, or some other group. Our PowerPoint presentation for the standards workshop is available that workshop is available, the presentation itself, on our website on the page where you go to the standards workshop. If you scroll down to the middle of the page, you'll find patient-centered medical home, and there is a set of slides that goes through each of the 9 standards and each of the elements, which provides greater detail. And that is the presentation that is given live each month. It takes about 2 hours, and you can see the schedule as well on our website. Other resources are just our 800 number. Customer support does answer questions about both the interactive survey system, and if you have questions about specific elements, they will forward your your call to one of our managers. We do encourage practices to use our email address so that we can respond to you in a written response. And for those practices that have a large number of sites that share systems, we do have an application process that helps you streamline some of the surveys. As I said, you still have to do a survey for each site, but we can accept one overall survey for some of the elements that are implemented identically throughout your sites. And so lastly, the slide contains our contact information. As I said, our 800 number, our website, and our email address for you to refer back to. So I hope I've saved a few minutes for questions.
Yes, we have a lot of questions.
Sure.
I'll start with the ones that are typed in. Henry Jacobs, who is a physician, asks, he's got several, so I'll put them together. Since OBGYNs act as primary care for many women, why are they not included in the primary care, the patient-centered medical home program? He also asked, the level of work associated with this process requires a full-time administrative person. Who will pay for this added burden to the practice?
Well, I'll answer the second question first. This is a voluntary program. Most practices participate in it either because they find value in documenting that they function as a patient-centered medical home, but frequently they are participating in some initiative where they're either going to receive a pay-for-performance reward or care management fee for patients. In some areas, health plans have sponsored practices. In your neighboring New York State, the state government is going to increase Medicaid payments to practices who are patient-centered, recognized by NCQA as patient-centered medical homes. You know, each practice would have to assess what value it brings to them and to their patients. On the OBGYN question, you can participate in the program. The area that becomes a little bit more difficult to respond to are those that one of the endorsed principles was looking at all phases of the patient's life. And while the obstetrician probably is concerned with the patient during childbearing, certainly the gynecology portion sees patients for a longer period, but you are expected to be the patient's primary care physician and coordinate all the other care. We do have many specialty practices that participate in our original program, Physician Practice Connections, because it is not focused so much on those endorsed principles where the patient's primary care is the core, but you're coordinating all of the other care. So we have not yet had an OBGYN practice be recognized in the patient-centered medical home, but you know, certainly you could assess whether you feel you can meet enough of the requirements to get recognized, and it would not prevent you from doing so.
Okay, we have a couple of questions from Drew Morton. His first one is the NCQA patient-centered medical home was designed under the auspices of physician-led professional organizations, and the language in the standards and guidelines focuses on physician-directed services. Considering the challenge with access to primary care services, non-physician providers are taking on substantially greater roles in the delivery of primary care. Does the NCQA anticipate expanding the program to recognize these non-physician primary care providers, such as APRNs and PAs, as team leaders and or qualifying practices? he has another long question as well, but why don't you can sort of answer that one first, maybe.
Yes, NCQA has included the nurse practitioners and will very shortly expand to PAs for our diabetes program. It's also going to be expanded to our heart stroke program. We've just worked out some details to include listing. And again, we recognize the practice, and we list the physicians associated with that practice. We will be modifying that to list the additional clinician types in the practice in the very near future. So we do expect that they participate. We've also had this discussion with residency programs where you know, the residents are certainly key members of the team caring for the patients. So we do recognize that they are all part of the practice. The only step that we have not worked out yet would be to have a practice that is not led by a physician, or that does not have a physician participating in the practice. So that would have to be sometime within the future.
Okay, and his other question is, in round figures, what costs would a small group practice expect to incur from NCQA to become recognized as a level 1, 2, or 3 practice? Annual NCQA fees and what are the annual fees to maintain that level?
There are no annual fees. You're recognized for 3 years once you achieve recognition. Our fee schedule is publicly available on the website. It's scaled by the number of physicians in the practice. For a single physician, once you purchase your license for the survey tool, which is $80, each physician is $450 for the application fee. If you're part of a sponsored initiative, there's a 20% discount on that. And there's also a cap of $2,700, so no practice would pay more than $2,700. But an individual physician application, review, decision, credentialing, all the steps that we take would be $450.
Okay, Sandy Carbonari has 2 questions. One, are there any pediatric practices currently recognized? This seems very adult chronic care oriented. And what's the average number of hours needed to complete the entire process? And well, she asked the total fee, but you answered that.
We have many pediatric practices that are recognized, and the conditions they often choose are things like otitis media, ADHD, well child care is acceptable, and special needs children. There are several of the elements that was one of the changes that was focused on when revising our original physician practice connections. The American Academy of Pediatrics was very involved and made sure that there were factors that addressed the pediatric population. So if you look on our website, you'll see several pediatric practices there.
Okay, and the number of hours?
Oh, well, really depends on where you're starting from. A number that's thrown out a lot is 100 hours. But our very first practice was, the submission was put together by the medical director of a 4-physician practice. They were very organized. They had a clinical information system, and she said she worked on it for a few hours after her practice, after her appointments were completed. And it did take her about 10 weeks, but, you know, an hour here, an hour there to work on her documentation. So it's very hard for me to tell you exactly how long it will take your practice, but those are a couple of the examples.
Okay, we have several questions from Richard Duenas. Has NCQA discussed the patient-centered medical home with the chiropractic profession? Do you recognize chiropractic physicians as PCPs? does your oversight committee include any chiropractors? And it looks like the same question again. So basically the role of chiropractors.
We have not at this time included chiropractors or recognized them as personal physicians coordinating all of the patient's medical care. Chiropractors do participate in our back pain recognition program. There are no chiropractors on the advisory committee at this time, but public comment on the program is welcome from all aspects of the medical care community.
Okay, and it looks like the last question is from Judith Myers. Are there any findings yet as to whether this process leads to better patient outcomes?
We do post all of the evaluations. Several of the demonstration projects are just in the evaluation stage right now. There are preliminary reports that for those chronic conditions such as diabetes and cardiovascular care, hypertension, hyperlipidemia, that it is having an impact on reducing hospitalizations and complications due to those chronic conditions, but not all of the studies have been published yet. We do point to whatever has been published in the resource section of our website.
Great. Well, thank you very, very much. This has been really helpful, and I'm sure it's created more questions than answers, but that's the way good presentations are. This will be available, the slides will be available on the SustiNet website, and the video at some point will be available as well. And I just want to thank you so much, Mina.
Well, thank you, and if any participants have follow-up questions they'd like to direct to NCQA, please feel free to use that email address.
Great, thank you.
Thank you. Have a good day.